Hi everyone. This time for Editor's Choice paper, I'm really happy to have with me Will Mason from the Sheffield Methods Institute at the University of Sheffield and Lisa Bunting from Queen's University Belfast. Good morning, both.
Good morning.
Good morning.
Morning.
Hi. We are going to be talking about one of the Editor's Choice papers for the latest issue of the British Journal of Social Work, which is titled Understanding Out of Home Care Rates in Northern Ireland, a thematic analysis of mixed methods case studies, which Will and Lisa did together with Kate Morris, Breach Featherstone, Gavin Davidson, Claire McCartan, Paul Bywaters and Callum Webb, colleagues who work at different universities, together with Lisa and also University of Huddersfield. It's wonderful to talk to you both about it. So just to kick us off, if you want to say briefly about what motivated this study, and it is part of a larger project, to maybe introduce the project too.
Okay, I'm happy to kick us off with that. I mean, this is part of a series of articles that came from a Four Nations project called the Child Welfare Inequalities Project. And what the key goal of that was to really think about and start to quantify for the first time in the UK, and actually I think quite uniquely in Europe and across the world. There's not a lot of study in this particular area. The relationship between area level deprivation, it was the particular measure that we were looking at, and the likelihood of a family, a child coming into contact with child and family social work, being placed on a child protection plan or becoming looked after. And the real motivation for this was, I mean, it was led by Professor Paul Bywaters, and Paul was hugely motivational in terms of this was his brainchild, and a big motivator for driving the study forward. Understanding that we have a whole wealth of research around health inequalities. We know that your risk of disease, of early death, of mental health, of various other issues are strongly related to poverty, that there are massive inequalities, that there are inequalities in access to health service and utilization. And yet, strangely, in the social care side of the house, there really wasn't any kind of research looking at that, even though I think everybody who works in practice in social care instinctively understands that that relationship exists. It's maybe a slightly different relationship in health, and particularly probably in child and family social work, because they're not necessarily interventions that are wanted sometimes by the people. So it's a slightly different relationship. It's not just about utilization, it's complicated, but there wasn't really any kind of quantitative research. So Paul had started doing research on this, and I'd run a pilot in a number of local authorities in England. And what he found was a very clear graded relationship. Every step up in deprivation, you could see these increasing intervention rates. And it was really quite startling. You don't, in social science, you dream of results like this, where you see that really strong, and visually you can represent it to other people and they can really see that how meaningful it is. And so he tested that and decided, well, what does this look like in England? What does it look like in the rest of the UK? And he brought a team of us together, of which myself and Will were very lucky to be part of, and to get together and put a grant application in that would try to test this relationship if it existed in other areas. What were the explanations? Would there be different rates? And really importantly, in terms of our discussion as well, is to develop really in-depth kind of qualitative approaches to trying to understand this, because practices can be very different in different places. So trying to understand how people think about their cases, how they understand the relationship with poverty, what other drivers are in there in terms of the system, in terms of pressures, workload, all that kind of complexity, the quantitative research never really can get anywhere near. And the qualitative approaches is really central to trying to understand. So it was really that motivation to fill that research gap, bring this issue to light more in terms of social work and social care, and to combine quantitative and the strengths of quantitative and qualitative to really make a meaningful contribution to the knowledge base.
Well, do you have anything to add? Your role was to focus on the qualitative research.
That's right, yeah. So I was one of the researchers who did the case study work, and across the breadth of the project, we've actually conducted case studies in local authorities and health and social care trusts in England, Scotland, and Northern Ireland. And there's some work that's being undertaken at the moment to replicate some of those case studies in Wales. Oh, so hopefully there will be an opportunity at some point in the future to talk about case study practice findings across the 4 nations of the UK. So this is a project that spanned, in terms of my involvement, from 2015 up to date, but the case study, the pilot work that Lisa introduced actually started a bit before that as well. So quite a substantial body of work, and the case studies were a mixed methods endeavour. So that included multiple qualitative methods as well as a sort of grounding in the quantitative analysis that Lisa's just described. So we were speaking to social workers individually and in focus groups. We were observing practice, shadowing some casework. We were talking to social workers about their decision-making processes and inviting them to map those out in some visualizations that we did in social work offices. So a real kind of variety of methods employed to try to make sense at a granular level what was happening at the kind of practice end of this story, and to ask social workers about their reflections on where poverty fits in social work practice and the extent to which poverty factors in the thinking and the decision making around supporting families where there's a risk of harm.
And for the funded study, that included 4 sites in England and 2 in Scotland and 2 in Northern Ireland.
That's correct, yeah. So originally 4 sites in England and 2 in Scotland, and then the Northern Irish case studies, which are the focus of this paper, were an extension to that project, because there was some really interesting quantitative data, which Lisa will explain, that prompted our kind of interest in trying to make sense a little bit more of some of the differences across the UK nations.
It's a nice segue over to you, Lisa, to explain how the work in Northern Ireland was shaped.
Okay, well, when we did the quantitative analysis, and what we found was across the nations, we found that exactly that same graded relationship with deprivation and increasing levels of child welfare inequalities or child welfare interventions. What we also saw, though, was that the strength of the relationship varied depending on where you were based. And even though in Northern Ireland the relationship existed, it wasn't as strong as we saw in other nations. So, for example, a child in Northern Ireland living in the most deprived 20% of areas had a 6 times greater risk of coming into care than been on a child protection plan than a child who lived in the most affluent areas. And for looked after children, the risk was 4-fold. Again, strong relationships, important findings, but that was counterbalanced, for example, for what we might have seen in England, where the risk was 10 or 11 times greater. So, and Northern Ireland, we talked about this kind of a lot, the policy context of each of the different nations, the legislative framework, where there's system factors that could explain how we might see things differently. Northern Ireland has an integrated health and social care system, has done since the 70s, does that, but nominally it has a very similar legislative framework. It has similar assessment processes. There's nothing there that would make you think that there's something that's happening at an overarching level that would be vastly different. It was also surprising because we understand that, deprivation often drives the intervention and referral rates, but actually in Northern Ireland, depending on the measure that you look at, but looking at area level deprivation would be one of the most deprived nations within the UK as well. So if anything, we've expected our rates to be a lot higher and the relationship to be stronger. So a big part of that was adapting to that and getting more funding in to do an extension and to develop the case studies in Northern Ireland to think about what exactly is happening. Are there systems there that might explain? Is it a practice issue? Is it about services that the people have access to? Is there other cultural differences? So really trying to use the qualitative case studies, that the method that Kate and Will had already developed in England and Scotland and used very successfully, to then explore some of these variations that we saw in the quantitative findings.
So Will, you're going to talk about precisely that, about the findings through the case studies, which are the focus of this particular article, and looking at why and trying to understand why the out of home care rates differ.
That's right. So yeah, so to kind of just follow Lisa, the puzzle then, and the real question for our exploratory studies in Northern Ireland was the fact that you've got these higher levels of deprivation and then relatively lower rates of children looked after, particularly in foster and residential care. So we really wanted to try to make sense of this at the level of practice, and to explore what might be going on across a multitude of different factors. And that's why case studies felt like the appropriate methodology for this approach. So sort of mirroring what we'd already been doing in England and Scotland, that meant at least 5 days of immersion in child protection teams across 2 health and social care trusts, and a series of interviews, focus groups, and a variety of other methods employed to just try to make sense of and understand where some of these differences might lie. It's probably worth saying that my background isn't in social work. So a lot of this meant me asking some pretty naive questions of social workers, and social workers very kindly accommodating me and those questions. So I want to say a big thanks to everybody who kind of looked after us during these case studies and accommodated that work, because social workers are very, very busy. So it's not the easiest thing to have a researcher sort of embedded in the site for 5 days, sort of asking daft questions and watching what's happening all the time. And what those case studies were revealed was a really interesting sort of set of complexities, really. And in the paper, we analyze that thematically and present it in 4 different thematic areas. And these areas intersect. So I'm going to quickly run through these in a fairly sort of surface way because of the time that we've got, but there's a little bit more detail to unpack in the paper.
And the paper is, because it's editor's choice paper, it's free to access to anyone. So anyone who wants to go into depth and detail, please do read the paper.
Great, thank you. Yeah. So the first thing that was really interesting was to do with social work systems and practices. And one of the things that we noticed when we spoke to the Northern Irish social workers, and we're thinking about this with reference to the conversations that we'd had in England and Scotland, was a slightly higher level of poverty awareness. So Northern Ireland, interestingly, experienced a delayed implementation of welfare reforms, but there was a real sense within the case study sites, and this is in 2018 when this work was actually taking place, that the kind of effects of the rollout of universal credit, for example, and welfare reforms were really starting to bite. And there was a noticeable sort of increase in the extent to which families were presenting with issues around income and poverty. So this was talked about quite openly by social workers in our general discussions. And social workers made reference to some really complex understandings of the relationship between material hardship and a variety of different sort of familial practices and difficulties. So the poverty awareness seemed to be quite clear when you spoke to social workers in a way that was unprompted. So when we analysed our data, we were interested in the differences between unprompted comments about poverty and prompted comments about poverty when we'd asked more directed questions. And in the Northern Irish data, there was a lot more unprompted kind of narrative coming from social workers about the relevance of poverty for families and the work that they were doing. There were also some instances within the data which demonstrated that aspects of the social work systems might be slightly more attuned to issues of poverty. So in the Understanding the Needs of Children in Northern Ireland, that's the Unicini forms that social workers completed, there was a duty to signpost a service called Make the Call, for example, which is an income maximisation service that can be used and accessed for free to support families to get a check on the benefits that they're receiving, to see whether or not there are opportunities to maximise those benefits. And these are subtle differences between the ways in which the social work kind of practices, forms and systems were attentive to poverty in a way that they weren't quite so obviously in the English and the Scottish data. The other thing that came across within conversations about poverty with social workers was the opportunity to access small amounts of money to support families who were in sort of quite acute financial need. So social workers talked about quite routinely accessing resources from their authority or from their service to support families with oil to heat their houses, or food in some instances. And in contrast to the data from our English case studies, for example, this was different because English social workers reported a kind of real level of bureaucracy around trying to access sometimes quite small amounts of money to support families with financial need. And the narrative from the Northern Irish case studies was that actually this was a bit more straightforward and a bit more routine. So one of the themes here is that when we talked about poverty and when we listened to social workers talking about the ways in which they can support families in poverty, some of this information was coming through a little bit more clearly in a way that was unprompted and with reference to being able to access small amounts of resources with relative ease in health and social care trusts. The second theme that we report in the paper is to do with early help systems and structures. And there's some complexity here, which was really interesting because across the two health and social care trusts where the case studies were based, there were very different narratives about the accessibility of early help for families. So in one of the health and social care trusts, social workers actually told a really clear story about a very strong early help offer. And this was in stark contrast to some of the findings that we'd analysed from the English and Scottish case studies. Social workers positioned themselves as lucky to be working in a trust where there was really good early help services, where family support hubs did fantastic work to cater bespoke sort of packages for families, worked well in partnership. And that was quite a kind of clear and stark narrative. The second case study site had a very different narrative. And the story there from social workers was actually that they were really struggling in terms of their early help offer. Services were being reduced, there were high waiting lists, and that was actually more similar to what we're used to hearing in England and Scotland. So there are some indications that in parts of Northern Ireland, the early help offer is really good in a way that's supportive for families and for social workers who are working with families, but there's some inconsistencies perhaps across the piece. However, in both of those health and social care trusts, when social workers were able to compare experiences of working in England and working in Northern Ireland, because we spoke to some practitioners who had experiences of both, Northern Ireland was always described favourably. And there are some examples, not all of which are in the paper, where social workers, for example, talked about cases where they'd supported families at child in need level in Northern Ireland with a good amount of support. Those families had then perhaps moved to England for work, and in transferring the case over, they'd been surprised and a little bit concerned to find out that they didn't meet any of the thresholds for supports in England. So the supports that had been in place would therefore be lost when the families moved. So there was an indication, albeit with some complexity, that the early help offer is perhaps a little bit more secure in Northern Ireland, but with differences certainly across the piece. The third theme that we revealed when we analysed the data, and this came through really strongly in the social work narratives, was to do with communities and kind of cohesion and social capital within communities. So interestingly, social workers in our Northern Irish case studies had quite positive stories to tell about working in some of the most deprived parts of their trusts. This was in contrast to some of the English and Scottish data where there was a much clearer sort of deficit narrative when we talked about working in some of the most deprived parts of the local authorities. Northern Irish social workers talked about strong communities, about connected communities, about communities with solidarity, and about communities who had experienced disinvestment for generations and as a consequence had become very good in some instances at campaigning for local resources and developing their own community-based services outside of state provision. So there's a contrast here in terms of the ways in which communities were discussed. And interestingly, we didn't really focus in this on much detail within the study, but it would be a really kind of interesting area for some more systematic analysis, is that more of the social workers in the Northern Irish studies were from the communities within which they practiced. So we were talking quite often to social workers who'd grown up in the areas where they were working. Perhaps that has some indication on the kinds of stories they've got to tell about those communities, but that actually felt quite different to the English and the Scottish case studies. So issues to do with community, the politics of that came through really clearly when we were asking social workers directly about what these differences, might be related to. And then that connects in with a fourth theme, which is to do with familial dynamics. So social workers also talked quite often with reference to Catholic communities about extended family support and familial dynamics and practices within areas of concentrated deprivation. Extended family were talked about here as a real resource for social work. And there were lots of anecdotes from social workers about instances where they've been called out to support a family and grandparents, aunties, uncles were already on the scene, offering to take children for a bit of respite care or to support. And social workers talked quite positively about working with extended families where they could, and extended families often being present within these communities, sometimes living on the same street, sometimes within the same postcode, and using that as a way to trying to wrap around and offer that familial support. And interestingly, that connects with some analysis that's been undertaken by members of the wider team, Claire McCartan in particular, around kinship care rates. So there are higher kinship care rates in Northern Ireland compared to England and Scotland, and that sort of married up a little bit with the qualitative narratives that we heard from social workers. So there's a few themes there, none of which are super clear. There's complexity across all of them, and they likely all intersect.
Yeah.
But what this allows us to do with the case studies is just begin to imagine a little bit more clearly and coherently why it might be that we see these counterintuitive trends in the quantitative data. And of course, that raises a whole bunch of questions for future research about unpacking some of these a little bit more clearly.
Which leads us very nicely into talk of study, how study was promoted and received, and also what the implications are for future work. I don't know, Lisa, whether you're going to talk about it or both of you.
Happy to talk about that. And obviously we published a lot from this. There was a very clear sense from the get-go that we wanted impact to be a big part of what we did, that we wouldn't just do the research and publish in papers, like your good self, that wouldn't just be the end of it, that it would actually take it towards practice, take it towards policy, really try and think about this. And as part of that as well, we also had a steering group, a kind of high-level steering group, which was really important. And for us in Northern Ireland, our chief social worker was on that. So that really was a big, big of understanding, key people, trying to think about allowing them to understand the study, comment on it, be part of the discussions very early on, and then sensing, what would be useful, what would need to come next.
And just to note to anyone who, sorry to interrupt you, but just to note to anyone who is not familiar, that in Northern Ireland, chief social worker is chief social worker for both child and family and adult social work, rather than split across the two.
Yeah.
Yeah, sorry.
Yeah, so have those, and actually, of course, Paul and Breed and Kate have done immense work as well in terms of giving evidence at committee in Westminster, of taking the findings to various different places, publishing blogs, articles, magazine articles as well, discussing the implications with practitioners. So there was an immense amount of work thought about what this means, because we felt that the findings were so important. And, some of the things, that a phrase, I think it's in one of the titles, the Wallpaper of Practice. This was something that, everybody knew. You worked with these families, you knew that they came from some of the most deprived areas. You knew that the kids that got taken into care were often from you could point to them on a map in your area, in your patch. And I think it was one of those things, we knew it so well, we stopped thinking about it and would stop trying to understand it. And actually by doing this and doing the quants, and also having this kind of, because I think what the qualitative studies really do is engender debate as to what is going on here, what can we actually do. I think that provided such a rich stream of data that by its nature, it captured people's imagination and understanding. And I think it took them back to the days when they were training perhaps as well, and thinking, what did I want when I wanted to be a social worker? What did I think that happened for a lot of people, even at very kind of high policy. What is social work for? Is it good enough to say we take kids from some of the poorest areas without doing anything else about it? Is there something else? So I think it's the nature of the research and the work that went into it, from Paul's leadership and everybody else who's such a fabulous speaker on this, just all kind of came together. And in Northern Ireland, for us, it was particularly important that Sean, our chief social, was involved and really quite, again, driven to try and do something in terms of practice. And so on the back of that, the department developed an anti-poverty practice framework for social work, and have gone on to develop a series of kind of practice related guidances as well, in addition, and really to try and think about how are we assessing this, how are we understanding it when we go into practice. What is it that we need to do? Are there things that we need to think about in terms of a community level? So I think there's a lot of work went on, and I think it had a powerful impact. And now the task is to keep that momentum going, to add to the research base and the knowledge so that it doesn't disappear again.
Yeah. And that the evidence base continues to expand, because as you both said, while it may be something which is taken for granted or can be part of practice wisdom, it's not necessarily part of knowledge base for social work. And it's important that it becomes and continues to grow in terms of evidence as to what type of interventions are important, which are poverty aware and early intervention, and understanding cultures and how they intersect with what we do. So in terms of what your plans are now, are you still involved with the project?
Yeah, just building on the point that you made then before I answer this question, I want to sort of shout out a few people who aren't part of the immediate project, but who are doing really important work in this field. So Anna Gupta, Rudy Roos, Complete Roads, Ian Cummins, Lord Dewankle, Emily Cadell, John Devaney are all colleagues who are doing really important work in the field of kind of poverty-aware social work. You also mentioned something really important there, I think, about the intersection of culture, race and ethnicity. Yes. Callum Webb and Paul Bywaters have published some work around this, but there's also some really important advances happening in the field that I'm aware of around anti-racist social work practice. People like Wayne Reed, Siobhan McKellen, and there'll be lots of other people whose names, are not on the list, so apologies for that. But, I think it's really great to see the ideas from the Child Welfare Inequalities project being expanded on and developed in important ways, both within the field of poverty, but more broadly around the kind of intersectional inequalities that impact families and are relevant for social work.
And that we are aware and recognise.
Rick Hood as well, who's done a lot of stuff, and Paul's been involved as well, and kind of really trying to think through the processes of the different factors and trying to look at longer term trajectories as well, because what we understand, and that's work we're also going to be doing in Northern Ireland, continuing forward, looking at data, trying to look at longitudinal trends in relation to deprivation, because understand it's not just a one-off, and that's while the original study, it's looked at data within a year, families are in and out of that system all the time, and actually how those incremental interventions then build up over a long period of time are really important to try and understand. So, I mean, it's been fabulous to see so many people take it on board, and just to become that CAL knowledge base building up and extending out, as well says, into lots of other different really relevant areas.
Absolutely. And across the generations, unfortunately, as well, and to continue that work. So what are you both working on at the moment, if I may ask?
Lisa, do you want to start and I'll follow?
Yeah, no problem. Yeah, well, part of it with money and the grant in at the minute, part of a bigger data linkage project that's led by Professor Dermot O'Reilly at Queen's. And we've asked we have a download of children's social care data from 2010 onwards, which has been linked to area level deprivation. And the idea is to do what we did with child welfare inequalities, but to map that over a 10, 11 year period to see, does the relationship change over time? What was happening in the policy or the practice context that may influence that? How stable is that? Another thing that we want to do is really get into the long we were aware when we looked at the data that there was an awful lot of other really interesting stuff in there. How often do families come back in again? Is there certain trajectories there, and how they link with poverty and admissions to care and placement stability and things like that? There's been some work in England where people have looked at data for over 6 years and find like almost 50-55% are re-referrals over that period of time. So there's a significant amount of activity and work that happens with families that are coming back into the system time and time again. So I think trying to better understand that and the relationship with poverty will be really important going forward as well. And I know Rick is in England, and I think Martin in Wales is also working on similar kind of longitudinal research as well. So I think they will be important contributions going forward.
Excellent. Well,
and my work is sort of still connected to the Child Welfare Inequalities group and project, but with a slightly different focus, perhaps. So my background's in sociology and in youth work. I'm a volunteer youth worker, and I sort of support the coordination of a local youth charity in Sheffield called Unity Gym Project. So a lot of the work that I've been occupied with more recently is to do with working collaboratively with young people and with the gym to explore different ways to support sort of grassroots community-based organisations with youth leadership as a sort of priority. Some of that work's now extending across Sheffield and Manchester. And within that, I'm particularly interested in examining and kind of trying to pilot new ways of looking at university community partnership, but in ways that are genuinely community-led, with reciprocity and kind of ethics of care built into those processes. So we have a history of universities of working quite extractively with communities. So one of the emphases on our collaborative work from the gym at the moment is exploring ways that we can work from the community, utilising the university resources towards our own ends rather than the other way around. So that's taking up most of my time at the minute.
That mutuality is a theme in a way from in between the lines from the work that you did, and it continues to be, it seems, Will, because universities used to have that reciprocity, but it got eroded. So it's great to hear that it's being claimed back.
Trying.
Thank you both so much. I feel like I could talk to you both for the rest of the day. And I really hope that this video encourages everyone to get to know the entire project and to read the article as well. Thank you both so much.
Thank you for the invitation.
Bye.
Bye-bye.